This is Behind the Headlines, with behind-the-scenes analysis on issues affecting Pennsylvanians, sponsored by the Susquehanna Valley Center for Public Policy. Now, here's your host.
Hi, from Philadelphia to Erie and from Scranton to Pittsburgh, it's Behind the Headlines. I'm Charlie Greenewalt, Senior Fellow for the Susquehanna Valley Center for Public Policy. I'm joined by my co-host, Maura Donnelly. Maura, welcome to the show.
Hello, Charlie.
Well, lots has been going on in the Pennsylvania political scene, in public policy. We've had now a debate. We talked about the debate between the gubernatorial candidates the other week. Now we had one between the lieutenant gubernatorial candidates. Did we miss the host of Jeopardy?
And the lieutenant governor? Yeah. I don't think so. I don't think anybody missed him.
Well, it was interesting, and it would certainly be interesting if we'd have a few more debates. Wouldn't it?
Would be. It would be good for everybody if we did.
Yeah, I think so. And certainly one of the issues that we'd be talking about is medicine and hospital care, medical care around the Commonwealth. And to talk about this, we are lucky enough to have Andy Carter come back and visit with us. Andy is, of course, the president and CEO of the Hospital Health System Association of Pennsylvania. Welcome back, Andy.
Thanks so much, Charlie. Good to be here.
Nice to have you.
Okay.
You know, we have spent a lot of time over the years, and we've talked with you recently about telemedicine. There is a movement on the Hill to promote telemedicine. Could you tell us a little bit about the legislation and where it stands and where it might be going,
Sure.
Andy? And could you tell our viewers again what telemedicine is?
Sure. Let me turn to that in a second, but if I could segue off a point you just made, is healthcare being so important as Americans prepare for the next election. A number of polls indicate that healthcare remains one of the very top issues, if not the top issue in some polls, on voters' minds. So it's appropriate to be talking about healthcare. And with telemedicine, it's the future of healthcare in so many respects. We have technology from high-definition cameras to smartphones that makes it possible to deliver high-quality healthcare across vast distances through this technology. Challenge is that too often it's not paid for. And we were supporting legislation that would have done a few things. One is define exactly what it is. And secondly, define who is allowed to provide it. You do have to know what you're doing as a clinical professional, a doctor or a nurse. And then finally, to require that insurance companies uniformly pay for it.
Is that not the case now? They won't?
It's often paid for. Right now it's up to individual insurance companies, and they don't always pay for it with all providers. And we can come back to that in a moment, where the insurance community stands on the bill. I'll go to the end of the story first. Unfortunately, the bill, despite being reported out of the Senate unanimously and the Senate committee unanimously and the House Professional Licensure Committee unanimously, at the end of the day, it didn't get across the hurdle before the legislature adjourned. So we have to get back at it.
What was the hurdle that it didn't get over? This is Senate Bill 780.
Senate Bill 780, and I have to begin just by thanking the champions of this legislation who, trust me, have been working very hard for several years on this bill. You have Senator Elder Vogel, you have Representative Quinn, she hopes to become a senator, and also retiring Representative Mustio, who really carried this legislation almost to the very end. The reason it didn't make it, many reasons, and I think the insurance community has grave concerns about it. Now, I'm not going to present their point of view entirely, but I do want to be fair. They want to make sure that any kind of requirement for payment includes sufficient protections, that they're not paying for low-value health care. And the hospital community appreciates and respects that. So what we want to do, working in the Assembly, is sit down early in the process and see if we can hammer out an agreement with our friends in the insurance community to do two things: provide the protections that they seek against people getting telemedicine services they don't need, for example, but also making sure that we can, as Pennsylvanians, we can count on insurance coverage when we do get treated. And it's not just the convenience of people like us. I'm thinking of people who live, 1/3 of our community in Pennsylvania lives in rural counties.
Rural, yeah.
And the idea that you could have access to high quality health care, counseling or guidance or services anywhere in Pennsylvania and have access to world-class specialists wherever they may be, we owe that to rural Pennsylvanians. And I think we also owe it to our children. Because, you know, take children that are victims of abuse or children who suffer mental illness. I got to tell you, there are not nearly enough child psychiatrists available to kids today. But if they had access to counseling services via video conferencing, for example, that would be a force multiplier that I think we'd all be proud to make available to these wounded children. So that's who I feel that are most disappointed, are rural Pennsylvanians and the children of the Commonwealth.
So what's next? You have to start all over again in January, correct?
We do.
Yeah.
We always get better with repetition. So I'm optimistic.
Like an old wine.
Exactly.
It gets better with age.
And we know there's tremendous support in the General Assembly to get this done. So I just think it's a matter of hammering out the details early in this new General Assembly and then getting it across the finish line by the end of next year.
So what else are you working on? I know telemedicine is really huge for you, but I know you've got a lot of issues going on. So what are some of the other big issues you're facing right now?
In some ways, one of our number one issues relates to telemedicine, in the sense the reason we need telemedicine in part is that we know we do not have enough doctors and nurses in the Commonwealth. And we have to address that challenge. And it's not just making sure we create enough educational opportunities for people to go into nursing and to medicine, but we have to create a better environment for our workforce so that when we get them to come work in healthcare, they remain in healthcare.
We want them to be happy.
We
As
do.
Patients, we want them
we
to
sure
be
do, because they're
happy in their workforce, in their daily existence. Yes.
And one of the challenges to their happiness in their work is the fact that hospitals are the center of where the opioid crisis is unfolding in America and certainly in Pennsylvania. When people are in trouble with a substance use disorder and they come to a hospital for care, I have to tell you the reports I hear from my members is that they're often violent and they are in the midst of an episode that they can't control. But often our workers in healthcare settings are at risk. They've been attacked, they've been injured. When I ask nursing leaders in our member hospitals their number one issue, it's protecting the safety of their staff, physicians, nurses, technicians, therapists. So that's a very high priority for us, and we've been working to survey our membership to identify the scope of the problem and to identify ways to address it. Obviously, we support, along with the governor and other leaders across the Commonwealth, strategies to get people into treatment, effective treatment quickly. But we also have to expand the capacity to treat folks. You know, it's one thing to get them on medicine-assisted treatment. Sometimes they need to be in inpatient beds for months, and we don't have enough of those beds. So we need to fight for the resources so that people can safely transition back into a sober lifestyle over time and support them. So that's a priority. We want to get people enrolled in healthcare. And open enrollment for the Affordable Care Act exchanges begins in just another week or so, November 1st through December 15th. Okay. So for people who need health insurance, now's the opportunity to get it affordably. And here's the good news. The cost of getting insurance in the Affordable Care Act exchanges has actually dropped a little bit for the coming year.
Do you think the cost is one of the issues that this remains a big political hot issue, healthcare coverage?
It does.
I mean, I think everyone expected their rates to go way down and the cost to go way down, and that's really not what happened. But you're saying we are now going to see a drop.
For next year, it's somewhere between 2 and 3% reduction in average costs for the people on the individual exchanges. So that's good news.
That's good news.
Now, it's still too expensive for many, many people. So we know we have more work to do. And that's another one. You asked our priorities. We continue to work to improve the quality of care and to lower its cost. It's one of our top priorities in the hospital community. We actually get some support from the federal government to bring our members together to exchange great ideas about how to do that better and more cheaply. And believe me, employers are demanding that my members deliver higher value at lower cost. And so the pressure on hospitals and all healthcare providers is to address that cost curve quickly.
Good. It's good news.
Well, in your discussion here, Andy, you were talking about members of the healthcare workforce, and you're talking about the need for training, licensure, and those are priorities for your organization. What are some of the other issues that face the healthcare workforce in Pennsylvania that your organization is looking after?
It's a great question. We have to do a better job as individual healthcare providers, physicians, nurses, therapists, working in teams. That's not something that's typically taught at nursing school or medical school, that you're not in there just to do your set of tasks. You're there to join together with people that are worrying about different dimensions of that patient's care, whether it's your mother or your father. That's a human being that has multiple needs that no single person is going to be able to address. That's the power of nursing and the power of medicine. When they work together as a team, patient care is far superior. But it's not easy to adopt that new culture of teamwork.
Yes.
It's a real challenge. And we're very committed to building a satisfied, happy, productive nursing workforce. And one of the messages that we are sending to our nursing community is that we're committed to their success in their work environment. And a whole bunch of assets need to be brought to the table to deliver on that promise. And that's one of our other priorities, the assets. We do need resources to continue delivering this care. So we'll continue being vigilant against any effort to cut payments to hospitals and to other providers that are providing essential medical services.
I witnessed firsthand when my dad was ill that there were maybe 4 or 5 different specialists working on him at one time, and so it's got to be a challenge because there might be a little bit of ego going on there with some of the doctors, and they're all like coming in and doing conflicting things, and that's got to be a really, really tough challenge to get everybody to work together. I wish you the best. That's
well,
be hard.
You know who's part of the team to make it work better? We as patients.
Yes.
We have a responsibility to
That's good to hear.
be aware of the multiple specialists providing our care or our loved ones' care, and ask lots of questions.
It does often fall on the loved ones because they have the ability to see exactly what the bigger picture.
And to ask common sense questions. I was talking to a colleague recently who told me that his mother was on some upwards of 25 different medications. And imagine the risk of those many medications interacting in bad ways.
Right.
And a common sense question that you and I can ask is, so, doctor, is it safe for all these different medications at the same time? So if we play our role, I think we can put pressure on well-intentioned clinical leaders, physicians and nurses, put pressure on them to work directly with us as patients.
That's great advice.
Okay, Andy, we have to have you back to continue this conversation because we have many more questions about hospitals and healthcare, and I think our viewers would like to be informed in, and you're the person to be able to answer those questions. So thank you for being with us today, and hang on for the second segment. It's coming right up here on Behind the Headlines.
Behind the Headlines is brought to you as a public service by the Pennsylvania State Association of Township Supervisors, the largest, most influential municipal association in the Commonwealth. Since 1921, PSATS has been preserving and strengthening township government and securing greater visibility and involvement for townships in the state and federal political arenas. Covering 95% of Pennsylvania's land mass, townships represent 5.5 million residents, more than any other type of political subdivision in Pennsylvania. Behind the Headlines is also brought to you by the Hospital and Health System Association of Pennsylvania, helping hospitals provide healing, health, and hope to communities across the state. And by the Pennsylvania Chamber of Business and Industry. The Pennsylvania Chamber serves as the frontline advocate for business on Pennsylvania's Capitol Hill by influencing the legislative, regulatory, and judicial branches of state government. Additional underwriting provided by the Worrell Corporation Foundation, based in Carlisle, Pennsylvania, by the Edward H. and Jeannie Arnold Foundation, and by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business. Behind the Headlines is also supported as a public service by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Visit pahighwayinfo.org.
Hi, welcome back to Behind the Headlines. On this segment, Maura and I are joined by Ken Mash, who's the president of ABSCUF, the faculty union for the 14 state universities. Ken, how many years have you been president of ABSCUF now?
Well, I've been president for 4 years, and it's my last 2-year term that I'm going to do. By the way, it's great to be
you
here.
You have term limits? Is this what you're saying?
We do not have term limits.
Have you announced
I have a
this?
personal term limit.
Oh, there you go. Okay.
Have you announced this? That this
Well,
will
I didn't
be...
make a public announcement about it.
Well, you
but
are now.
well, there you go.
Can we make sure we have somebody who replaces you as good as you?
Well, I certainly hope that that's the
Okay.
case. I have a great vice president, and I'm hopeful that she'll decide that that's what she wants to do.
Awesome.
Maybe she'll do the show sometime.
Well,
That would be great.
knowing all the things that you're responsible for in Harrisburg and the hours that you put in and the effect that it has on your personal life, it's a great sacrifice to do the job that you've been doing for years now.
Well, there's certainly sacrifices, but, for me, it's just so rewarding to know that what I'm doing is helping not just our faculty and coaches, but also our students. And I think as we fight for quality education, as we fight for additional funds for the state system, as we try and get a voice for the faculty with things like the system redesign that they're going under, that, I'm doing good things and helping out. And the fact that I do what I do and I have other volunteers who also work with me, I think this our faculty to focus on the students and the research that they want to do. So I'm happy that I had the opportunity to do this.
Are you going back to teaching then?
I absolutely am.
That's great.
Yeah.
And you're being modest because you've been one of the leaders in Pennsylvania education, in Pennsylvania higher education, and you've made a difference.
No, that's nice of you to say.
No, but it's true. It's true. And one of the differences you've made is you've established a whole new relationship with the state system of higher education, which has a new chancellor. And you and the chancellor are off to a wonderful start. You have a great relationship. If I can say that on camera, I hope I'm not talking out of school, but
Just say so far so good.
so I was wondering if you could talk about the new chancellor for a moment.
Yeah, the new chancellor comes from the Gates Foundation, where he was in charge of the higher education portion of what they do. He has come in with a very different style from his predecessors, where he has wanted to engage the faculty and engage others. Look, I'm in a position where, there's always going to be disagreements with people, but I think with Dan Greenstein, at least, we get the sense up front that he really cares about public higher education. He cares about the university. So when you do have disagreements, but you feel like you're still on the same general mission, it makes it a lot easier when you do have those disagreements. So I'm cautiously optimistic about the future. It's my responsibility to make sure that the faculty continue to have a voice, that we continue to try and do great things for working class families and getting them the education they deserve.
So he stepped in right into the middle of a state system redesign. It had been underway for at least 18 months or so before he jumped into it. So he has inherited that. So tell us a little bit about how that's going. I think it started in June 2016, got underway. So tell us what that redesign is all about.
So the redesign began under Frank Brogan, who was the chancellor at the time. It was then, when he left, picked up by Karen Whitney, who was the interim chancellor. And they set up really 3 task forces, one to focus on student success, one to focus on university financial health, and the last to just look at the system itself, and really was the main system redesign one. It's not that Dan Greenstein has come in and said, let's throw everything away and start over again. But I think what he's done is taken the work that's been done by these task forces before, made them more inclusive as far as including students and faculty and staff, and gotten them involved, and is in the process of really working on doing something that's going to be student-focused, with our universities, making sure that we maintain quality education. But I think the thing that impresses us the most is he's been so far very demanding about making sure that things are not based on, what someone feels, but rather it is supported by data. And that when we're making choices, we understand the directions that we're going on the best that we possibly can before we do it. And I think and Charlie might attest to this, when you're talking to faculty, they want to know that what you're saying is supported. I think some of the things that make my colleagues the most cuckoo sometimes is when they feel like they're talking to someone and they really have no basis of support for what they want to do.
One of the big things that makes a difference, I think, for many of my colleagues and myself is having administrators come in very often and then just wanting to make a mark, and so they just unilaterally start changing things without studying them and without building a consensus, without bringing everybody along. Isn't that so important in institutional change, Ken, that you need to work with the union, work with the employees, and make those changes together?
Yeah, I think it's, first of all, it's a concern in the system, and I think it's one that's going to be addressed, the fact that we have some issues with leadership where people seem to be coming to our universities, scrambling around, doing all kinds of things, and then using that to pad their resumes and then leaving. And I think that that's a matter of concern. It's something that we've talked about already. It may not be the first priority thing, but it is something that eventually has to get addressed.
And it's gone on for years.
Oh, yeah, no, it's been going on for a long time now. But you're absolutely right. And this is one thing I think why my colleagues are impressed by Chancellor Greenstein is that he has come in and said, look, you have to engage all the people who work at the university. You have to engage your faculty. We're not going to be successful if our focus is on student success. You need to, bring in the people who have the direct contact with the students. And that's the faculty and that's the staff at the university, right? It seems crazy. But, it's crazy, it seems like, of course, it's common sense.
Right.
But we've gone through now, I think, a decade of really this vast separation, administrators doing one thing, and faculty really just being in a place where we're just complaining about it more than anything else because we have been disempowered to really have an input. And I think people appreciate that, even as I said, where we may have some disagreement, we still appreciate having the opportunity to have input, if we've got a good suggestion, to know that it's been heard, even if we're disagreed with, to have it explain why that disagreement exists. And that's not about a union issue. I think when a university focuses is running properly, that's what we expect is going to take place.
So where are we in this redesign process? There's task forces in place, meetings going on. What's the timeline and where are we in the overall redesign?
I think that, I know that the Chancellor has put forth a pretty aggressive deadline. So he really wants to be able to present at least the broad outlines of the findings of the task forces in the January meeting of the Board of Governors.
Oh,
so that's within a few months. Now, it may not be that there may be other steps that have to take place after that, but he wants the general outline of the direction that people want to go in to be set by that point.
Can you give us some hints on some of the content, Ken? At least some of the things that are specifically being studied. There's so many universities that have in the last few years said, well, we need to get rid of language studies. We don't need French anymore. We don't need German anymore. We don't need Latin anymore. Mm-hmm. And they're not necessarily replacing it with Arabic and Mandarin Chinese and Japanese. And some schools are trying to say, well, we don't need philosophy anymore. Where are we going? There was a movement at one point. What we need to make some of our schools like Mansfield more driven by the job market in that area, and maybe they should be focusing more on some needs in geology and mining and fracking, for example. Where are we going?
Okay, well, a couple of things about it. First of all, we're still in this phase, so I don't feel totally comfortable talking about where the direction is, but I know the
Fine,
things...
I had to ask you.
No, that's right, but I know the things that we've been talking about and advocating for. And one thing we have to understand about Mansfield, you brought up Mansfield, for example, that's a university in a region where it's the only game in town for people. At the same time, you know, and people have some misperceptions about that because it's gorgeous up there, but there's some poverty up there, and people are struggling. At the same time, Mansfield has driven up the cost of going there so high that they've really costed themselves out. So what this chancellor has brought up, and we've been talking about for a long time, is you can't just focus on tuition. You have to look at the total college cost that brings in room and board and the fees and everything else, and say, is this a realistic price for the students in the area? And, you know, and that's going to require us advocating for more money for the system, but also looking at ways that we can do things more cost effectively. And I think that brings it back to another point that you were making about the losses of language, which we've been talking about. Instead of saying to folks, look, we're not going to have French anywhere, we're not going to have Chinese anywhere, doesn't it make sense, given the technology that we have and that we could put to use, to have collaborative programs at our universities, share resources? Each university may not be able to support, for example, a philosophy department, but we may have philosophers at each one of those universities that if we gave them the ability to work together, they would be a pretty impressive philosophy department. So we need to be exploring those opportunities for our universities to cooperate where they can. In order for us, you know, it's not just a matter of cutting costs, it should be even more important to provide opportunities to students.
So it's time to get creative in some of the ways you're looking at things.
Absolutely.
So it looks like you have your plate full with this redesign, but what else is APSCUP worried about right now?
Well, we do.
I shouldn't say worried. You know, working on.
Look, we're concerned about the allocation for the state system of higher education. We're concerned that there have been a number of bills out there, both anti-union bills, which have directly targeted us, and we think misinformed along the way. We're concerned about our contract, which is going to expire at the end of June. So there's always a lot on our plate.
Didn't you just sign a contract?
We did just sign a
like
contract. It seems like we've always been in contract negotiations over these last decade.
Wow.
And of course, we're concerned about the continuing existence of Cheyney University, which we believe and continue to believe has an important role to play in Pennsylvania. And we want to make sure that it has the capacity to be able to serve the students who need it so much.
Ken, unfortunately, we're out of time. But we welcome you back, and we hope you'll come back very, very soon. And we hope you'll come back again next week for another edition of Behind the Headlines. And we'll see you then.